Hello, my name is Dr. Sujay Chandran, a consultant cardiologist practicing at Kingston and St Thomas's NHS Foundation Trust, and I'm here today to talk to you about chest pain. So chest pain is one of the most common reasons that patients come to see a cardiologist, predominantly to rule out the fact that they're not going to die from a heart attack, but it's commonly misunderstood. There are many causes of chest pain, but it's really important to try and decipher and work out the type of chest pain that you're having, and whether this could be the early warning signs of a heart attack. So, using my expertise, my general approach is to take a very careful history, which is the most important thing, and try and determine the kind of signs and symptoms that a patient may be displaying or describing. The most common cause of chest pain related to the heart, which we describe as angina, is typically described as a chest discomfort which occurs when you're exerting yourself, where you'll feel a tightness in your chest, as if someone's sitting on your chest, and the discomfort can sometimes move down your left arm towards your jaw, and you can sometimes feel sweaty and nauseous with this. If this happens on exertion, this is called stable angina, and it's usually relieved once you rest. If you ever get these symptoms at rest with no provocation and the chest discomfort does not go away, that's an urgent indication to call an ambulance and go to hospital. Now, it's a really interesting fact, but 1 in 5 patients who actually suffer with a heart attack don't necessarily always get those classical symptoms. So there are variations of this. So that's worth keeping in mind. So in terms of evaluation, apart from the history, we use investigations like blood tests, ECGs, and then sometimes echocardiograms to determine what may be going on. And then after that, we may have to use specialized tests such as CT coronary angiograms or invasive coronary angiograms to look at the heart arteries in detail to either rule in or rule out your heart as being a cause for your symptoms of chest pain. And then depending on that, we can either reassure, give lifestyle advice, medications, or use techniques which I'm trained in, such as angioplasty or coronary intervention to try and unblock those arteries to provide relief and relieve chest pain, which is caused by the heart. So in summary, chest pain is commonly misunderstood, but there are early warning signs and symptoms which should alert you to the chest pain being caused by your heart. And if there's any doubt, always just get checked.